All right, outstanding. Thank you very much. My name is Courtney. I'm coming from Northwestern, and I'm going to tell you everything you need to know in a very short period of time on burnout. So where does this data come from? Mainly this work, a positive response of emotional exhaustion or depersonalization, is the Maslow Burnout Inventory. But it's really an important thing to understand. When you hear burnout, this really only comes from 22 questions, and emergency doctors on this study were just 333 of the actual responders. But sadly, this finding was validated 3 years later, where 70% of physicians self-reported burnout by the same indices: depersonalization, emotional exhaustion on the MBI. But that's really not the whole story. This work also asked for work-life balance. And here you see emergency medicine is in that kind of top upper section. So yeah, we're burned out, but we're also reporting pretty good satisfaction with work-life balance. So not really the whole story here. There's lots of different ways that we can survey burnout. The MBI, which this study used, was only one of them. There's also a 2-item short Maslow that you should know about. There's the Mini-Z, which measures also some questions about your EMR. And the Stanford Wellness Survey is one that's emerging now as kind of one of the perhaps next gold standard for measuring burnout. But I really want you to understand, when you hear burnout, where does that come from? This is the 2-item short Maslow. And really, it's simple. I have become more callous towards other people since I took this job, and I feel burned out from my work. If you answer that a few times a week or more, then you're going to have a high correlation of reporting burnout on the MBI, the whole 22 thing. So let's take a look a little bit more to deep dive on this. I'm not going to go through all of this, but if you take one reference from this talk, this is it. This was Shanafelt 2017, Executive Leadership and Physician Wellbeing. It's a great model for not just the drivers of burnout, but the sources of engagement and well-being. And what you see across the top here is that we can talk about burnout and these factors in terms of individual factors, work unit factors, organizational factors, and national factors. And I really want us to kind of frame and think ourselves about burnout and well-being as how it impacts on this. Now, we can also look across the other side of this graph and see that there's different demands or different drivers of these. Some of them are big, some of them are small. Workload job demands, resources and efficiency, culture and values, control and flexibility, community and social support, work-life integration. So it's not enough to just talk about burnout. We have to really drill into what some of the causes are. The individual factors are the things that we can kind of control. And you most control these when you get a job, right? That's when you decide how much you're making. You decide how much you're working, how many hours, where you're working. These are all really important things that you control because they're at the individual level. But at the work unit, it's a lot harder. Productivity, teamwork. Do you have scribes? Do you not? Do you have an efficient admitting process? These are the things that are really kind of difficult to control. And then, even at the organizational factors, things get even more complicated, because we see here, these are things that are not just controlled by your department, but they're controlled by your healthcare system. And they kind of come down to the M's, right? Money, medical records, and mission. So it's really important to think about, how do my values align with my organization's values? Those are really important things to think about. We're going to talk a little bit about social support and community at work, because I find it pretty interesting. We had some people from the C-suite show up and say, like, hey, what would you like that would improve wellness? And the faculty's really quiet. No one's saying anything. And then all of a sudden, I say, I'd like a kick-ass coffee machine. I think that would help. And it was kind of tongue-in-cheek, but what I was really getting at, and I published this in the SAEM Pulse last year when I was the president of SAEM, is we need a place where people can connect, where people can communicate as human beings, where people can share their experiences and stories. And this was one quote: "Until we can interact with each other as human beings and see others in the modern medical machine as unique individuals, we will struggle with treating patients as human beings and unique individuals." And I really think that's part of the solution to burnout. It's not going to be the whole thing, because I've showed you a lot of these organizational factors. This is the other thing that really drives depersonalization. How many times you guys call and this is what you get? Yeah, this is ortho. Radiology. Yeah, this is the hospitalist. And the solution to that is to say, no, I'm Courtney, what's your name, and introduce yourself. The EMR, we think the EMR sucks, it's terrible, it's taken us away from the bedside, but is it? I surveyed our faculty. I asked them to say, how much time do you think that you're spending in the EMR? They said a median of 190 minutes. That's a tremendous amount of time. Then I got the data from Epic. I actually measured how much they were in the EMR, and the median was only 112 minutes. So they were overestimating how much time they were in Epic by an entire hour in an 8-hour shift. So it's a really interesting thing, because it kind of dives into the question of perception and reality, right? So what I'm trying to do now is I'm trying to basically provide some information and data so that people can replace replace perception with reality. Now, maybe that's still too long to be in the EMR, and if you look over here on the right side of this graph, you can see there's a ton of people that are spending a lot more time in the EMR as outliers. But that's probably not the total solution either. It's not the phone, it's not a coffee machine, it's not just the EMR. Part of my survey also looked at this, which is how do we describe our work environment? 73% of us describe it as somewhere between busy, hectic, and chaotic. So I've given you basically some things to take home. I've told you about how to measure burnout. Now you know what those two domains are. You understand it's not as simple as just what we thought. Giving you a great reference to read. And I want to really charge you with thinking about the individual factors, the work unit factors, and the organizational culture. Those are the things that we really got to think about. What can we change? What can we not change? And then what do we need to change in the future as we define the field of emergency medicine and beyond? Thanks.
So thank you for the presentation, and I think it raises some points that we can all bring home both on the department level and on a residency level, and hopefully work together to overcome the burnout issue. So thank you.
Thank you very much. Thank you, organizers.